As the debate over going back to school continues across the country, a hidden health concern aside from the coronavirus has pediatricians very concerned.
Medical reporter Liz Bonis shares an alarming new report on childhood vaccines.
So how you feeling about the school thing with all this?
I'm a little nervous.
Yeah.
Jennifer Young has 2 children headed to school this fall.
I think it's hard to say what's the best thing to do at this point, so you just go with it.
Her youngest, Barris, just 2. He's here today for something his pediatrician, Dr. Robyn Gorman, says has fallen behind for many parents in this pandemic: child checks. These also include updating school-required or recommended vaccines.
An outbreak of a vaccine-preventable illness in the setting of coronavirus would be very worrisome.
Dr. Gorman not the only one worried. This report from the Centers for Disease Control shows what Ohio public health specialist Greg Kesterman says his research shows as well.
So we have started to see vaccination numbers lower than where we'd expect them at this time of year. In fact, here at Hamilton County Public Health, our clinic is seeing numbers 54% less than they were in previous years.
The concern, of course, is that while the debate continues about getting kids back to school with coronavirus still circulating in many communities, other vaccine-preventable illnesses might be far more likely to get kids sick.
Measles, for example, if the vaccine rate in the community drops below 90 to 95%, there's a risk for outbreaks because herd immunity is not achieved. So that puts everyone at risk, especially vulnerable patients.
Part of the reason she said you can't just let these go is that there's a schedule for vaccines. That's the way it's researched, that's the way it's healthy, and that's the way they're most effective.
We have about a month before school starts in many instances, and now's the time to start scheduling your appointments with your primary care physicians. If you don't have insurance and you need vaccinations, you can work with your local health department, who will be able to provide those as well.
The immunity itself takes at least a couple of weeks to build up in the body after a vaccine, so you can't get shots the last few days before school begins and go back to school without putting others at risk.
We are worried about outbreaks of things like measles or pertussis becoming a problem if we don't achieve high enough levels in the community to protect everyone.
A familiar lesson, you might say, we all now better understand as we see how quickly the virus COVID-19 has already spread outside the classroom. I'm medical reporter Liz Bonis reporting.